Bongo Maga, Filipinas. Good morning. You're watching Eagle News Mornings from Canada. I'm Thomas I. Likeness, reporting from our Eagle News studio in the Western Canadian province of Alberta. My city is Edmonton, and I'm here to bring you news and commentary from across the country. Well, it's Monday morning, start of another work week. So let's begin the week with a look at the weather in Metro this morning. AccuWeather forecasting a cloudy day, 60% chance of a thunderstorm this afternoon in parts of Manila. Should get up to about 32 degrees today with a real feel of 39. Currently under a partly cloudy sky, 26, feels like 31, and the air quality is fair. Well, I just made a fresh pot of coffee for you. Grab yourself that second cup, sit back, relax, and I'll tell you what's happening in Canada. First, we'll take a look at our weather across the country. Our street scene today coming from Surrey, British Columbia. That's part of the greater Vancouver area. And a big thank you to Ian Suarez for this shot. Starting on the west coast, Victoria reporting mist in the air and 13 degrees. Much the same in Vancouver, where it's misty and 14. Across the mountains to Alberta, where it's 16 degrees with light rain on and off in Edmonton. Calgary reporting smoke in the air, 23 degrees. In Saskatchewan, Regina, mainly sunny and 20. Saskatoon, mostly cloudy and 18. We go to Winnipeg, where we've got clouds and 15 degrees. Light rain and 11 in Toronto. Ottawa, the nation's capital, mostly cloudy and 14 degrees. Montreal, mostly cloudy and 15. The Atlantic provinces, they've cooled down quite considerably. We're into the fall season now, so it's only 12 degrees and clouds in Fredericton. Halifax, mostly cloudy and 16. Really chilly up in St. John's, Newfoundland. Under the cloudy sky, we've got 10 degrees. Some of the stories we're following this morning: U.S. President Donald Trump's condition is improving. 2 Canadian provinces struggling with a second wave of COVID-19. It's lights, camera, but no action in BC's film industry. The top story in the world right now is the condition of U.S. President Donald Trump, who is in Walter Reed Military Hospital, where he's being treated for COVID-19. Dr. Brian Garibaldi, a member of Trump's medical team, says the president's condition is improving.
Today he feels well. He's been up and around. Our plan for today is to have him to eat and drink, be up out of bed as much as possible, to be mobile. And if he continues to look and feel as well as he does today, our hope is that we can plan for a discharge as early as tomorrow to the White House, where he can continue his treatment course.
Meanwhile, White House physician Dr. Sean Conley says going forward, the president will have a different look.
Well, the president wears a mask anytime he's around us, and we're all wearing our N95s, full PPE. He's the patient, and when we can, when he'll move out into to public, we move him out and around other people that aren't in full PPE. I assure you, he'll as long as he's still under my care, we'll talk about him wearing a mask.
Trump was taken to hospital on Friday. Back to Canada now. Surgical patients in the provinces of Ontario and Quebec may have to wait longer for their operations. Hospitals are coping with an increasing number of coronavirus cases. New cases in both provinces rose and total more than 1,000 as the week ended. That's 1,000 on a daily basis. Canada's public health officer, Dr. Theresa Tam, is warning that hospitals could be overwhelmed by the number of new cases. And that's, of course, going to mean more delays for people waiting for elective surgery. Surgeons are already working overtime trying to clear a backlog from the first wave of the pandemic earlier this year. This second wave means more restrictions, less social interaction. The Quebec government telling people who live in regions where there are big outbreaks to keep their contact with family and friends to a bare minimum, at least until the end of the month. And in Ontario, our Eagle News correspondent, April Masongsong, tells us more restrictions are in place.
On Friday, Ontario saw 732 new cases of COVID-19, its highest number of daily cases to date. Earlier this week, Premier Ford officially announced that Ontario is now facing the second wave of the pandemic. Here's the Premier talking about the recent COVID-19 projections for Ontario.
Earlier this week, we received a real wake-up call. We saw from the modeling update that if we don't act now to halt these trends, we could see 1,000 new cases a day by mid-October. We could have 200 to 300 people a day arriving in our hospital ICUs. In fact, there are 732 new cases today. We're in a second wave of COVID-19.
For this reason, Premier Ford announced Friday that Ontario will implement stricter and more specific public health measures to get ahead of the anticipated COVID-19 projections. These targeted restrictions will be implemented in Toronto, Peel, and Ottawa. They include the following. Restaurants and other food establishments are only allowed up to 100 customers with no more than 6 people per table. Customers must leave their contact information at the establishment for contact tracing. Gyms and other fitness settings are restricted to a maximum of 50 users, with exercise classes restricted to 10 individuals or less. Banquet halls, meetings, and event facilities are restricted to a maximum of 50 people per facility, with 6 people per table. In addition, masking policies are now extended to the entire province. Here's Premier Ford with the details.
We're expanding the masking policies already in place in many communities to the entire province. That means wearing a mask when shopping, when taking public transit, and when at work if you can't keep 2 meters between you and your colleagues. As much as possible, we also need to limit close contact with anyone outside your households. This will be especially important to consider as we look ahead to Thanksgiving next weekend. We also have to extend the pause on the reopening of any other businesses or facilities for another 28 days.
In consideration of the winter season and the colder temperatures, new measures for COVID-19 testing will also be implemented.
The weather is driving more people indoors, which has led to more community spread and a surge in testing. As the weather begins to worsen, we can't have people waiting in the cold, waiting in the rain and snow to get a test. So today, we're announcing new changes to help the assessment centers get ready for the winter. Starting Tuesday, October the 6th, all assessment centers will be moving to appointment-based testing only in order for our assessment centers to make the necessary adjustments in order to winterize their operations. Beginning Sunday, October the 4th, assessment centers will not be accepting walk-ins. The vast majority of the assessment centers in Ontario that already offer testing by appointments will continue to operate as usual while we make this important transition.
Ontario completed more than 40,000 tests Friday, with 323 new cases in Toronto, 111 in Peel Region, and 141 in Ottawa. More than 50% of new cases are people under the age of 40. There are currently 167 patients in hospitals, of which 38 are in intensive care unit, and 21 of which are on ventilators. In Toronto, April Masongsong, Eagle News. We live in interesting times.
In British Columbia, the film industry has had to put the production of several television programs on hold. The entertainment industry publication Variety magazine is reporting production companies can't get COVID-19 testing done quickly enough. According to the report in Variety, the company overseeing the COVID-19 testing can't handle the volume. That's because it's also doing testing for the province's schools, and that's become a priority. The stoppages are expected to be temporary. Still to come, is a winter vacation in Hawaii feasible this year? Will Canadians be flocking there like they've traditionally done every winter? You're watching Eagle News Mornings in Canada. It's 7:16.
The New Era University, in its 45th year of excellence, discipline, and service to humanity, will offer online education all levels beginning this first semester academic year 2020 to 2021 through the NEU Virtual Learning Environment, or NEU VLE. New Era University offers a complete basic education cycle from kindergarten up to senior high school, offering all strands. NEU has 18 colleges. And 2 graduate schools. It also offers ALS and ETF. Best of all, NEU has the most affordable tuition fees among private universities in the Philippines. NEU is at Quezon City, the city of San Fernando, Pampanga, General Santos City, South Cotabato, Lipa City, Batangas, and Pinugay, Baras, Rizal.
New Era University is under the stewardship of Dr. Dilo L. Rosas.
What are you waiting for? Be part of the new normal. Enroll now. Classes start on October 5, 2020.
This is Eagle News Mornings from Canada. I'm Thomas I. Likeness. It's 7:18 if you're just joining us in Manila, 27 degrees. Well, joining us live now from Honolulu, Hawaii, Eagle News correspondent Alfred Asenas. Good morning, Alfred. How are things in the Aloha State?
Aloha there, Thomas. The weather here is still warm overall, and it's still waiting for you and our friends there in Canada. In fact, I got this blue Hawaiian shirt that's waiting for you, Thomas. Just say when.
Yeah, well, you may have to keep it in storage depending on your answer to this question. You know that Canadians from Western Canada have been taking winter vacations in Hawaii for years. Hawaii has always been our top choice for the winter. But with the pandemic, should I be booking a trip now? Will I even have a place to stay when I get there?
Well, Tom, here's the latest according to the state's tourism authority, and just for our audience's knowledge, the border between our two countries, to include our ports of entry here in Honolulu, unfortunately remain closed except for essential travel workers and for certain trade of goods. Now, just to give you some numbers on how significant Canada is to our industry, between 2016, 2017, even 2018, thereabouts, we've averaged between 400 to more than 500,000 visitors coming from Canada. That's a pretty significant number, even though it actually pales in comparison when you talk about countries like Japan and the mainland U.S. That number in the millions, each year. But 500,000 for us is helpful. Now, since the pandemic began, and we've been tracking Canada's arrivals here for the month of August, there have only been 100 visitors coming from Canada, which compared to more than 28,000 the same time 1 year ago. So an answer to that question, Thomas, is it's going to be very difficult to be able to book anything at this time given those restrictions. However, and I want to share with you and our audiences there in Canada and around the world that this month is actually going to be something that's we're closely monitoring the travel industry because several airlines have started offering pre-travel COVID-19 testing in lieu of having to go through a 14-day quarantine here in the islands. I can name you several right now that I've researched with. We did a report on United Airlines, which actually was the first to announce such a plan. Hawaiian Airlines followed suit a day after, but not so much on an exact date. And then you have several others, one's coming from Seattle and one's coming from Dallas-Fort Worth that are offering something similar. Nothing concrete yet. Everything is still dynamic as to what they plan to do soon as the industry here starts opening up a bit. As you know, we're here on the island of Oahu. We're under Tier 1, in which there's been some bit of openings up. But I will tell you, Thomas, even if the hotels here get the go-ahead to open back and to resume normalcy, it's going to take a while, because you have those who got laid off are mostly, some of them are not going to come back, or not going to want to come back. They've chosen to move on. So it's going to take some time, one, for the travel industry to be able to implement those options, and two, you got the hotel tourism industry here is going to need some time also to reach the proper manning to be able to accommodate these visitors.
Sounds like it's going to be a while, Alfred. Thanks for joining me this morning, and we're definitely going to have to get together for some Loco Moco when my wife and I get back to the Aloha State. You take care.
And I got your shirt right here. Yeah.
Hopefully I don't gain any weight and it'll fit.
No, you won't.
Okay. I know this is a Canadian show, but I'd like to bring you some offbeat stories as well. And here's a couple of them. First, I want to tell you about flying doctors, British style. Now, in Britain, emergency responders and engineers have successfully tested the world's first jet suit paramedic. Richard Browning, the founder of Gravity Industries, gave a demonstration. I thought we'd have it up here on the screen. He flew from the bottom of a valley up to a simulated casualty site in just 90 seconds, and to make that same trip on foot, it would have taken 25 minutes. The Great North Air Ambulance Service provides emergency air response across swaths of northern England. Spokesman Andy Mawson says this could transform how lifesavers reach isolated casualty sites. Mawson says time is of essence in rescue operations.
But that hour is an hour that somebody is lying in pain or maybe deteriorating from something that sounded maybe innocuous at first, like perhaps becoming a bit breathless and feeling a bit sick. But actually that patient's having a heart attack. For our paramedics to get on scene within a matter of minutes and recognise that can mean the difference between life and death.
The next step, of course, is to figure out how to roll out this technology and pay for it. And now we go to the city of Brussels in Belgium, where it's social distancing with a difference at this restaurant. Belgium's Dinner in the Sky, where guests can enjoy their dinner in line with coronavirus restrictions, 50 meters above the ground. The restaurant's owners said the pandemic has forced them to adapt. And let's have a look at how this works.
I cannot even look it down, but I'm afraid of heights, but it's a challenge for me. So I'm glad I do it. I'm doing it.
There's no room for error there. Waiters have to make sure everything is brought to the table while it's still on the ground. It's impossible to serve, of course, when the table is 50 meters in the air. And here's something you don't want for dinner. Thieves broke into a home in Blaine Lake, Saskatchewan. Among the loot they got away with were half a dozen poisoned steaks. Police say the malignant meat had been in a freezer. The steaks were purposely contaminated to be used as an animal control measure, but police say they could make a person seriously ill or even kill them. And are you a bowler? Well, how about this woman from British Columbia? Now, first I want to credit this small-town newspaper, the Salmon Arm Observer, for the story. The paper writes about Florence Pinio. She's almost 98, and last Thursday she bowled a 117-point game. Florence got a late start in bowling. She didn't actually take up the sport until the age of 71, and for the last 26 years she's been bowling at Lakeside Bowling in the community of Salmon Arm. Florence says old age runs in her family, and she expects to be around for a long time. And are LeBron James and Anthony Davis a dynamic Lakers duo like the great Shaquille O'Neal and Kobe Bryant were? Well, let's find out from Eagles sports correspondent Kenny Sumagi.
LeBron James and Anthony Davis combined for 65 points in the Lakers' win over the Miami Heat on Friday. The Lakers tandem are the first duo to combine for 30-plus points since Shaquille O'Neal and Kobe Bryant did it in the 2002 NBA Finals. LeBron and AD are humbled by the comparisons made, plus AD tells us who is more like Shaq and who is more like Kobe.
obviously being in high school and watching the Kobe Shaq duo, it was the most dominant duo that I have personally seen in my life from a basketball perspective. Hadn't seen, obviously, we knew the force that Shaq brought to the table, but the elegance and force that Kobe played with as well. They were very dominant in what they did on the floor, on both sides of the floor. So to be in a conversation with those two guys, myself and Anthony, myself and AD, he's going to kill me. Myself and AD, it's just very humbling because, I know I grew up watching those guys. I grew up admiring Kobe, obviously, for, kid coming straight out of high school. So, admired that kid that was young and got the opportunity and obviously the force that Shaq played with. So I'm just very humbling. We're happy that we can be even mentioned with those greats.
Those two guys are obviously special. That duo is special together. The best duo we've seen. Multiple championships. But they both are so dominant. I know they had a little sit down. They was talking about they were arguing because they both wanted to be so dominant. They both wanted to be great. They both wanted to win. And that's why they kind of gelled together outside of everything else that you might have heard that, they were going through. But those two guys were selfless. They both had a competitive spirit with themselves to will their team to win.
Tune into Eagle News for more on the Lakers' championship quest for another NBA title. In New York, Teddy Samagi, Eagle News, we live in interesting times.
That's our program for today, and as always, on behalf of the Canadian news team and Alfreda Stennis in Hawaii, I wish you all good health. Take care of others. Take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Stay tuned for Kid Cuento